so many IPC programs, from injection safety to healthcare waste management, so many researches that has happened at their university, and she's still very, very active. She's a facilitator in the ongoing course that is on logistics as well as budgeting and making sure that things work out at our facility. And I'm going to just take you over, but while she's waiting to do her presentation, we have to just take a small logistic management poll to know where we're coming from. So please, over to you. You go to your chat box and then just a quick one, just answer yes or no. It's very simple, true or false. And then we'll see where we are. And then at the end, she will run through it. And then we'll see where we are so that we'll make sure we are taking something home from this session. So go to your chat box and answer the questions. Can we all see it? Does anybody have any challenge? Chat box. Welcome, Abdul Fattah Suleiman, Christopher Aliu. Well, good afternoon to you all. Question 1, all of us are saying question 2, this is initially mark that. And then at the end, we'll come back and see, can you scroll up? Scroll up so that we'll see what the other questions are. Before we go into the presentation, number 3 and 4 is mostly true for number 3, false for number 4. That's the end. So thank you all very much. But we want to make sure we are participating because we are all adults. And adults learn by doing. So now I'm handing over the presentation over to Mrs. Olubunmi Omisore to take us through logistics management in the healthcare sector. Okay. Make sure everybody contributes to this. There's no wrong answer, there's no right answer. But at the end, after the presentation, we will come back so that we will know whether we have done it all correct or not. So I'm handing over to Mrs. Omisore. Thank you. Thank you. Thank you very much. You are most welcome. Most welcome.
Good afternoon, everybody. I'd like to encourage you all to take part in the answering the poll questions. It's just to let us know where we are at, then we can know what we did at the end of this discussion. Thank you.
So we have just 1 more minute. Dr. Muka, Dr. Muka, do you want to say something? Your hand is up.
Sorry, no. Let me put it down.
Okay, pull it down. Thank you very much.
Is it down?
No. Okay.
No, it's down.
Okay, thank you.
So I think you can now take your presentation. Thank you very much.
Good afternoon, everybody. My name is Olubunmi Omisore, like I said earlier on, and we're going to discuss logistic management in healthcare systems. Basically, what we're going to talk about is the supply chain, how to make sure we get it right so that our products are always available at all times in the healthcare system. Basically, the steady flow of medicines and consumables and all supplies is an essential part of implementation of best practices at various levels in our healthcare delivery systems. And to achieve or put a good logistics management system in place, the reason behind this, like I said earlier, is to make sure that we don't have interruptions in the delivery of healthcare, because the quality of our healthcare is, it contributes to the quality of delivery of healthcare when you have a good logistics management system in place. So, logistics management consists of 3 different tiers. We have the onset, which is the planning and developmental stage. Then we have the actual implementation of the program. And finally, of course, the sustenance and continuity of the program. Now, what I have LMIS in brackets is Logistics Management Information System. The sustenance of the program is based on a good LMIS. That means there's information, there's data collection to help us with sustaining the program. So what are we going to discuss today? Basically, we're going to define what logistics management is. We're going to go through the different aspects of the logistics cycle. We're going to discuss inventory management and control. And finally, we're going to discuss the challenges that we have in logistics management that cause us not to be doing it right. So what is logistics management? It's the part of the supply chain process that plans, implements, and controls. Please note, those are the keywords. It plans it, it implements it, it carries out the project, and it controls effective or efficient flow of storage of goods, services, and other related information from the starting points, that's the point of origin, to the end points, that's the point of consumption, to meet our customers' requirements or the end users, basically. It also means the strategic management of processes of procurement, movement of goods and supplies, and storage of commodities until they get to the end user. So, logistics management information system is the management of the flow of items, information, and ideas through a coordination of supply processes. Please note, is the management of information and ideas based on our past records, based on our stock records and information that is historical when we look back and helps us to project into our future needs. So what is logistics management? This is a diagram showing us what it is. If you look through the diagram, you see the supply of raw materials. There are different contributors to this chain. Of course, from the raw material supplies, we get those who manufacture, and then we get people, from the manufacturer to distributors, wholesalers, or retailers, and then the end users. This is just a basic supply chain community. Then we have what we call the reverse logistics. This goes against our normal logistics movement. And how this happens when we have reasons to return commodities or supplies back to where they came for different reasons. We'll talk about those reasons later. Just note reverse logistics goes in the other direction that the supply chain community goes. So we'll go back to definitions again. Logistics can be defined as A, the management or general management of how resources and commodities are acquired, how they are stored, and how they are transported to their final destination. You have to acquire them, they have to be kept somewhere. All those are very important because you have to make sure that there's adequate room for storage after you've acquired, and you have to be able to distribute them to the final end user. It's also defined as the movement of commodities from one place to another according to schedule. Now, according to schedule is the key phrase here, because if you move it 2 minutes after it is needed, then you are not getting it right. It's not available as and when it is needed. So it has to be moved according to schedule. And what is relevance of logistics? It ensures the continued availability of supplies and equipment, therefore meeting customers' needs. It has to be continuous. Of course, when we're talking about, most of us know that we have the OS syndrome, the out of stock syndrome is really commonplace in our environment now, and that causes system failures. It causes a lot of problems in the healthcare system. So a good logistics system has to have continued availability of supplies and commodities. And finally, a good logistics system affects the outcome of healthcare delivery, of a healthcare delivery program or service positively, which means that a bad one makes a healthcare delivery system or service fail. We're going to go to the logistics cycles and discuss the components one by one. Now, if you look in the middle, you can see logistics. For logistics, you need information. And that is why record keeping is key. You have to be able to account for how you have consumed things in the past. Of course, for a good logistics system, we also need money. Finance is key. There has to be readily available finances, and that means we have to be in connection, we have to be in tune with the money keepers in our different organizations. And finally, we need people. We need human resources to affect a good logistics program positively. What is the priority of the logistics cycle? We can see the first one, serving customers. All this from the first person on the supply chain to the second person to the next person, we are all targeting the customer. Our aim is to serve our customers according to schedule. Let me put it that way. These things have to be available to our customers when and where they are needed. Now, how do we go about serving our customers appropriately? The first step is product selection. You have to make sure that you choose the appropriate commodities for the receiving end users. And there's a process that you have to undergo in selecting. Product selection, we'll go through that, is based on a lot of factors. We'll come back to that later on in this presentation. Then next, we have to forecast. It will have to be a lot of forecasting, and then we'll now set out to effect procurement. Forecasting is predicting your actual needs based on past usage, which is documented. Based on past data, you are able to predict that barring unforeseen circumstances, we will need 100 boxes of latex gloves this month. That is forecasting. And of course, after forecasting, we now go through the process of procurement. Between forecasting and procurement, of course, you have, if you want to invite suppliers, if you want to do tender bids, there are different things in between, and then you do the final procurement. Now, after procurement, we receive the inventory, we receive the stock, and after we receive it, we learn how we have to distribute it to the appropriate end users, and that is called inventory management. There are different systems of inventory management. Is making sure that we are never totally out of stock. We are never out of stock. We're discussing the ideal now, not what happens. We manage the inventory in such a way that our goods and supplies are always available to the end user when they are needed. So like I said, this is a diagram of our different customers. Everybody is waiting for different reasons or different needs. Serving customers is the priority of the logistics cycle. I said that. So we determine who are these our customers. Are we talking of, is it an I program? Like sometimes you can decide that you want to tackle river blindness in X state, or you want to address infant mortality in a particular healthcare system. Those are the services. Those are who our patients are. Now, when we know who our patients are, then we decide what services do they require. Where do we want to put the spotlight on? Where do we want to focus our attention on? And this is what determines the next step of selection of our products. So, other components of logistics system I discussed earlier. We have product selection, then I've discussed the forecasting. You have to have historical consumption data, and then of course you buy, procurement, and then you distribute to the stations or the units where they will be used in serving our end users. So a good logistic management information system has to be in place. And of course, we need human resources. We need staff, we need healthcare workers, we need people who are in procurement, we need people who are in the stores. We definitely need human beings to make sure that we're running a good logistics system, and we need finances and budgeting. And that is why we have to carry management. Members of our management team have to be involved so that they can know the necessity and urgency anytime we need to make procurement. So the next stage is planning and developing of inventory supplies in a healthcare program or facility. I'm using a healthcare facility, a hospital. Healthcare programs, they come up all over the nation now. You can have cholera prevention, something like we have COVID management or intervention programs all around the different countries in the world. So how do we plan and develop the supplies of inventory for these programs? First, you check the scope of service. How broad? Who are the people we want to serve? How wide is this our network of people, our target audience? Determine the scope of service. That allows us to have an idea of the numbers we want to cater to and all that. Then, what are the requirements or resources that are essential to make sure we can provide these services? That's when we have committees that sit down and we make different lists of what we need, and of course finances are involved after we've done our selection and all that. And then we have to make sure we are making a rational selection of our supplies. How do we go about that? And that brings me to the 7 logistics rights. A good logistics system aims to make available the following: the right goods, in the right quantity, in the right condition, in the right place, at the right time, to the right customer, at the right cost. That's a mistake. To the right customer, at the right cost. I'll start with right goods. Now, there's no point you having loads of 20 mil, I'll use something pretty basic, 20 mil needles and syringes in pediatrics. In that case, those are not the right goods. The right things that are relevant for your scope of service has to be available at the point where they are needed. And they have to be in the right quantity if you want to run good quality healthcare service. There's no point that only 25% of your patient population is their demands are met. They have to be in the right condition. It cannot be damaged or expired, or they say store in a cool, dry place. It has to be dry. It cannot have marks of dampness on the packaging. So that is the right condition in the right place. I always like to use this example because a lot of us in our facilities, we will actually have the item, but the person that is holding the key to the store or the cupboard is not available. So that means that commodity is not in the right place as at when it is needed. It has to be accessible, which boils down to at the right time. The time is important. If there's a patient who needs a particular, let's say, medication, and we're still expecting it to be brought to the facility in two days' time or 2 weeks' time, our timing is wrong. That's why I use the term according to schedule, making sure that commodities are moved according to a predetermined schedule. Of course, to the right customer. Customers' needs vary from patient to patient or from end user to end user. So what customer A needs is different from what customer B needs. And we have to make sure that what customer A needs is available to customer A when the time has come to supply the commodity and at the right cost. Now, cost is very key in this part of the world. We're a developing nation and we're resource limited, let me put it that way. Our resources are limited. And of course, even, there are end users who need certain commodities, but they are out of reach. The cost is definitely not affordable to them. So that's where sometimes we have to come to the issue of choosing generic over branded for reasons of cost. And for those systems where you run, maybe you have like eye blindness or eye surgery program, you have to make sure that whatever cost that you are pushing to either the healthcare facility or to the patient is affordable, or else that way it will be available and it will not be consumed at the end of the day. So those are the 7 logistics rights. I'll go over them again. The right goods, and make sure they are in the right quantity that will supply majority of your clients. In the right condition, they should be kept in such a way that they are suitable for use on the long run. They should be in the right place, being accessible at the right time, to the right customer, and at the right cost that is affordable to the end user. So how do we implement an effective system? Well, we've discussed inventory control and management. You make sure that you monitor how these things are distributed and are consistently available. That's what it means basically. And it has many processes, one of which is procurement. We said that to make sure that you buy the right things from the right sources. Then you receive the items into your stores or warehouses, making sure that the stores are adequate for your commodities, the right temperature, the right means of storage, the right shelving, and making sure that they are well protected from light and moisture. that is part of storing and warehousing. Now, issuing of stock to the end user. There are two systems that are well known in logistics. We have the push system, the one where the issuer, the person in charge of the stock decides what is going to issue to the lower units. This is done for various reasons. Either, he doesn't, he has too much of it and wants to make sure that if he doesn't push it out, they might end up getting expired on him. Or maybe you have a large donation and nobody's really asking, and you are looking that maybe they are not aware, so you are the one who pushes out the stock to the end user. Then we have the pool system. This is the most common one, where people requisite for stock or commodities that they require in their various units. This is the lower unit is asking the higher units, the stores, that this is what they need to run daily operations. So of course, there's distribution of commodities to the various sites. Sometimes it involves transportation, depending on how big the warehouse is. It could be like a central medical stores that decides what that they're going to distribute commodities to various sites using the push or pull systems. And then finally, our stock taking and reordering. That is so important to logistics management information system. It's our data collection. Our data collection or collation shows us when we need to reorder so that we have continued availability of our commodities. Continuity and sustenance of supplies. An effective healthcare delivery program is only as good as the quality of services it can offer for the lifespan of the program or for the lifespan of that healthcare facility. And so as such, we want continuity and we want to maintain a steady stream of things that are required to deliver healthcare services to our end users. Supply chain continuity management refers to the capability of the healthcare facility or system to ensuring uninterrupted flow of products and services from suppliers to customers within an acceptable level and time frame. Of course, this is the way we safeguard the prioritized activities within our organizations and within interested parties. So inventory control. These are the steps that you need to keep our supply chain moving. This is a summary of what we've said. Now, the procurement and supply chain is in the middle. We can see good executive leadership. That means they are willing to make sure that things run, which is something that we lack in our, in a lot of our facilities. Good leadership will make sure that things run very well. Then, of course, we need good financial standing as well to be able to maintain a good supply chain. Finance obviously facilitates procurement when necessary and making sure that supply chain is smooth. And of course, at the end of it, we have satisfied customers and we have suppliers. We need suppliers who will keep the supply chain running effectively. So we've said a lot about how to manage our logistics in our healthcare systems. But then again, I'm sure a lot of us are waiting to discuss the challenges that we have that are affecting the reason why we have not been able to perform optimally. The quality of the logistics. The quality of the logistics management information system is affected by please mute your microphones, thank you. The quality of logistics management information system is affected by funding, which if it's inadequate will always be a problem. Then, of course, there should be good forecasting and projections into consumers' needs. Then, usually when we have budgets and they're about to be executed, sometimes there are deviations from the budget. And there can be legitimate reasons for that, because there are situations which we did not plan for that occur now and again. And then interruption of the delivery of commodities, interruption in receipt, interruption in distribution, they all affect quality of our logistics management. Now, for logistic management interruptions, we can classify them into two groups. Some are related to the supplier and some are related to the consumer. And I will just run through them. And of course, I don't know if it's kind of interactive, but I'll discuss who is responsible for what. Yes, we could have procurement delays. Usually, this can only be from the end user. People tend to to request for procurement when it's almost, when they're almost exhausting their supplies. In a well-managed logistics system, procurement should be prepared for well ahead of the points where you are getting to your emergency supplies. So this comes from the consumer, and sometimes it's affected by management of the organization because of paperwork, approvals and the process. This takes time, and as such, we have delays in procurement. Now, delivery delays, it could be both sided. It could be from the supplier. Usually it's from the supplier, but it could also be from the consumer. Some suppliers deliver to some units, but in some cases, it's the units that go to like a central medical source to go and pick up. So delivery delays or distribution delays, they are basically the same. Distribution delays, you can get to, the commodities get to the warehouse in the facility, and maybe the auditors are taking 2 days or 5 days to come and I'm giving you examples so that you can identify with this sort of things when they come up. And of course, that makes sure that the commodity is not available until the auditor has seen what is, has certified that they were actually bought it. Commodity defects. If you have commodities that have defects or are damaged, of course, we will not be able to use it. And like I said earlier, that's when we have reverse logistics. And reverse logistics itself, it's another topic on its own and causes nothing but delays in our logistic management. Supplier performance, we should try and make sure that we are connected to suppliers who have a track record of performance. Transportation, in this system, I'm sure that is not news, where we have transportation issues now and again. Either there's no fuel or there's no tire, or the cost of transportation might be too high. So in between those, making our decisions, there's time going, and as time is progressing, the inventory level is getting lower, and we might get to OS levels. Cost of inventory, that is very important. The last time you bought this particular commodity, it was X. And when you are planning, you planned with X Naira. But now it is X times 100% or whatever. So that there's a bit of a negotiation, or are we going to reduce quantity? Are we going to ask for more finances? So inventory cost has a way causing interruptions as well. Then environmental uncertainties. I need not speak too much on that. We're just getting out of the COVID era, and we know what it did to our steady supply of inventory in different facilities worldwide. Finally, customer satisfaction. I referred to it when I was discussing commodity defects. If the customer is dissatisfied, we now have reverse logistics, in which the commodity has to go the other way up, down the chain, back to the supplier, probably back to the manufacturer, and then so these are the sort of interruptions that have affected the management of our inventory in times past. So these are my references. Thank you for listening.
Thank you very much, Mrs. Omisore. That's like giving us a big umbrella for us to start thinking about. And as we listened, I hope we're looking at our facilities, or if not our facilities, wherever we go for healthcare, and start thinking about what to do. And then you are thinking about your own questions as well. So on that note, she's giving us the big overview. That's what I would call it. And I want us to now look at a case study about the neuropsychiatric hospital pharmacist, the chief pharmacist, to share with us the health facility experience, and then we can holistically now look at it, and unless it is what Mrs. Omisore has told us, and then we can discuss. And then you can ask your questions after that. We have the whole day today to talk to them, but I just want to give a brief introduction about Mrs. Peters, Mrs. Olawunmi Peters. When she's educated, she went to only child, did her A-levels in England, and then came back and was educated at Maiduguri University. And I think she's worked all her life almost all her life at the psychiatric hospital Yaba, and she's managed the store. For her to get right to the peak of her profession there, and she's the head of the department. So she's here to share her case study. And then as we listen, and then we can interact with both facilitators today. She's going to talk about Please, can you mute your mic? Please. Please, now over to you, Mrs. Peters.
Good afternoon, ladies and gentlemen. I would like to thank the Nigerian Society for Infectious Disease Control for inviting me to do this. I am indeed glad to be here. I'm going to discuss today on the supply and logistics at the Federal Neuropsychiatry Hospital in Yaba, where I work, as she said. I've worked there for almost 35 years, and I'm head of departments. Now, Federal Neuropsychiatry Hospital was founded in 1907 with the first batch of 48 patients, what used to be called then as an asylum. 115 years later, it is now one of the largest, busiest federal mental health facilities in Nigeria, with a patient database of over 20,000 annually. The hospital is located at Yaba, Lagos. That's the front of the hospital. And we have an annex at Oshodi. Also in this annex, we have a specialized child and adolescent clinic, which is actually the first in Nigeria. We have 25 pharmacists, we have about 30 interns, 4 technicians, and we have a few support staff. So provision of pharmaceutical care services to this large population will definitely require high level of accuracy, expertise, and numerous skills for us to ensure that we provide safe and effective medicines, which are always available for our clients. Now, let's look at the process involved in logistic management in the hospital. The first thing is your budget consideration.
You need to have a clear idea of how much to use in purchasing your medication. It's like you're building a house and you have money. If you're going to, you have to check whether your money can build, is it a 2-story building or you want to build a high rise. If you don't have enough money, then you know you have to build what you can afford with the money you have. So this is very, very important. Now in psychiatric hospital, we run what we call the job revolving fund. Now, about 15 or so years ago, the government gave us the 6 stock, which we have been able to grow over the years to what we have now in our accounts. So as I said, it's based on your budget. After the budget, after you look at your budget, you now go into the selection stage. Now, there's some factors that affect how you select your medications. Your drug need is very important. Now, you have to check what you have in your stock. So you're going to select based on what you are running out of. So, for example, you look at your stock. If you are running out of something like paracetamol, you're not going to buy that. If you have more of something like ampicillin, you might not need to buy that. Now, indication is very important. The psychiatric hospital do mainly psychiatric patients. So we have to look at the disease condition available at that time. If we are having more of depression, then we're going to buy more of antidepressants compared to something like anti-epileptic drugs. Now, the prescriber's preference is very important. I have 2 examples of medications there. If you have your doctor's preferring generic, like the Atadone there, there's no point stocking up with Mispadal, which is a brand, a known brand. But as much as possible, we want to cater for our patients across the line, those with low end income and the high end income. So you have to look at all this when you're selecting new drugs. I remember there was a time there was a particular doctor who wanted to buy, I think it was Mesadone or something. And he made us buy this thing, pressurized us into buying this thing. At the end of the day, they were not prescribing it. So we ended up having most of this medication expiring on the shelf. And we do not want this. Now, the next stage is quantification. At this point, we use quantification methods to determine approximate quantity orders for purchase. This stage is very critical because if you don't buy the right amount of medication, you might have stock out or excess stock. Now, you don't want to have stock out because then your patients will not have medication. And you don't want to have excess of that because these drugs will now be on your shelf. You are tying money down, and sometimes they end up expiring. So over the years, from experience, we have been able to determine what we use for a quarter, for example. In psychiatric hospital, what we do is that we use the tender process. There are different methods. We have the local purchase order, we have the direct purchase order. We use the tender process because we have found out that it is more competitive. So hence we can get our drugs at a more reasonable price. Now what we do is that we have a form up there that you can see. We buy drugs quarterly, that's every 3 months. Over the time, as I said, we have the experience, we know what to use over a quarter. So we determine, for example, let me say, Procurement, for example, we're using 100 in a quarter. So you go back and look at what you have left in the stock. If you have 30 left in the stock, and you know you're using 100 in a quarter, 100 minus 30 is 70. So you're going to buy 70 plus a few more for any eventuality. So we do this for all the medications. You can see the form there. So let me say tablet metformin. The web pack is 500 by 100. We have a column for brand price. So if we have a preference for a brand, we put it there. And then we now put the quantity required for that quarter. Now, prices are sent to the suppliers. At the beginning of the year, we have registered suppliers that have been pre-qualified. So they register at the beginning of the year. So when this form is ready, we invite them, they pick up the form, we give them like a week to quote and return back to us. Now, when this is done, we have the tender committee that sits. This tender committee consists of the pharmacist, the doctor, the procurement officer, the account staff, as you know, one is very important, and the storekeeper. Now, when they return the state, we put the data on the spreadsheet to make it easy for us to compare the prices. And then we now award the contracts. Now, in awarding the contract, take cognizance of some things: the product quality, the price, and the track record of the supplier. Now, the quality is very, very important. You don't necessarily buy the list. I know it is important because of the money is important, but then we don't normally generally buy the list. We look at the quality of the brands that we offer. I remember most times we even take the sample, we are not too confident, to the lab to do analysis of it. There was a time that a particular brand of chlorpromazine was supplied to us, but we're not too comfortable with this. We had 100 milligrams of it. By the time we took it for analysis, I don't want to say what quantity was of it. So generally we do this, regularly to make sure that we're getting a good quality, because our patients depend on us, so we don't want to disappoint them. There's no point selling things that are not going to affect the patients. I know psychiatry, they're very, our patients are very dependent on us, drugs are not really available. The brands is important because they ask to give it. If you change the color, they might not even take it. So for the prices, let me give you an example. For example, we have 3 companies and they've quoted for a particular brand. And maybe the company for the particular brand, maybe your brand in that brand them the same category. And somebody has quoted 4,000, somebody quoted 3,008, another person quoted 3,007. 3,007 is the lowest price, yes. But if we are buying a large quantity of that drug, what we do is that we call the suppliers. Oh, can you supply at 3,007? And if they say they can do it, then we spread it. Because sometimes if you give a large quantity of drugs to a particular supplier, you might end up having problems because they might not have the capital to do. So we spread our risk. Okay? And then for the track record, some suppliers deliberately underquote because they want to win the tender. And then at the end of the day, they cannot supply. And then you have a problem. Because by the time you now go back to the next person, you tell you, oh, I quoted for this like a month ago, or the prices have gone up. So we actually look at the track record of our supplier. And most times, if they disappoint us, we actually blacklist our suppliers and don't give them anymore. So after we have done this, we have looked at what they've quoted. We will now give them what we call a contract letter. Now, in this contract letter will state what they have, what they've quoted for, the quantity given them, the price they have agreed to supply. All this is stated in the letter, and then we give them a period of 4 weeks in which they have to supply. Now, as soon as the drugs are ready for supply, a team is on ground to receive this. The team is consists of the auditor, the company representative, the store officer, and the pharmacist. Now, what this team does is that they check that what is on the letter is actually what they have supplied. They check for the brand, they check for the web pack, they check for the quantity, and make sure that, as she discussed earlier, that the product is in good condition. And then, once we are sure that all this is okay, the store officer will now enter this in the bin card. Okay, we do both manual and electronic. So it does this in the bin card and enters this in the system. Now, the quantity of drugs are written there, the name of the drug is written there as well. And then he takes it into the store, the medication to the store. It's arranged according to pharmacological classes on the racks. And we do this based on first expiry, first out system. So the drugs with the nearer expiry dates are placed in front, while those with the further expiry dates are placed at the back. Because we don't want to use the further one and then leave the other ones and then end up expiring on our hands. Now, the store, the logistics pharmacy in the store receives the drug from the main store. We have a main store into the holding mini store on a weekly basis, because we do not want people to go into the main store now and again, just to prevent errors, pilferage, and things like that. So this, she does this into the main store, into the holding mini store. And then from there, she now issues to the different units. We have requisition booklets that are used to document our movements. In the hospital, we have different receiving units. We have the outpatient receiving units, the emergency, the child and adolescent, inpatient, we have the staff clinic as well. So from here, we now distribute to the end users, to our clients, to our patients. So that completes our logistic movement from the supplier to the patient. But we saw that there's some challenges. Okay, thank you. Some of the challenges we face, bureaucracy. This is due to the long procurement process involved between the back and forth between the companies and the tender committee. Now, the way we are able to overcome this is by starting the process early enough. Because we do our logistics and procurement quarterly, that's 3 months. So by the end of the second month, we have started the process. So by the time the 3 months is complete, the process is finished and because suppliers are ready to supply. So this way, we make sure that we do not have out of stock syndrome. As I said, our patients mainly buy their medications from us. So we must make sure that we have stock at every time. So we have to forecast enough and do all this on time. Now, another problem, challenge we can have is human factor, counting errors, concern about staff attitudes towards work. This is a huge problem. Now, the way we've done this is that we mitigate this by we double checks at every point and random cycle checks to make sure that what we have actually, for example, we can go into the store once a week or twice a week to make sure that what's actually in the bin plan is what we can see physically. This way we can actually check if there are errors all the time. I remember there was a time, there's a dog we normally issue, maybe in 10s. And so the storekeeper, knowing that we normally issue 40, and this particular time all we wanted was 4. Because it was used to issue 40, he just put 40 in the card. He issued 40 out. So at the end of the day, we saw that we were short by 36. But because we did it on time, we had to go back to look at our records to check. At every point, as I said, we use both the manual and the electronic system. So we check that we can actually monitor our drugs right from the supplier down to the end user. So we do this on a regular basis. And then we constantly train and retrain our staff to increase capacity. And then we have a good working environment. So at least this stimulates them to do their work better. And we also have what we call the job role fund allowance. Because we know that logistics, we have a lot of paperwork to do. So we give them, apart from their salary, this little allowance that motivates them to do their work. Another challenge we face is government policies. A lot of our medications are imported. So when the government decides to change the policy, or there's a strike at the ports, it affects the companies getting in drugs. But we have been over the years been able to develop a good relationship with our suppliers. So because we are the main users of these antipsychotics, by the time they are running out of the company, they inform us. So we quickly buy and keep. So by the time we're finishing that, their new stock has come. I remember during COVID, we had our logistics pharmacies had foresight. So instead of buying for 3 months that we normally do, we bought for over 6 months. So during COVID, we did not have out of stock syndrome at all. In fact, patients of other hospitals came into the hospital to buy medications. Something else we did was that there's a big company, I don't want to emphasize it, but it's a major company that sells a branded drug of one of the major antipsychotics that we use. So we had an agreement with them that look, if we buy a large quantity, can you give us at a lower price? And they agreed to give us at like 40% discount. So the whole of this Lagos, you cannot get the price at what we're selling it. So what we do is that we actually now talk to other hospitals. Even Louvre comes to buy from us in bulk. So these are the things we do. These are, from over the time, over the years, we know what to use and know what we can do. We know that another thing is payment. Because if you do not pay the suppliers on time, they will not supply you. So we have been able, because we run a drug law, there's always money in that account. And then we have a good relationship with the account department, So we made them at least 4 weeks. Within 4 weeks, our customers, our suppliers are paid. So this makes them pay us. And another thing is that it makes them give us the medication at a lower price. you can negotiate for this. You don't put so much markup. You know you're going to get your money back. You know you're going to supply us again the next quarter. So this makes us get our just a very reasonable price. So we know that every system has its own challenges, but we need to be prepared to overcome them as they arise. So in conclusion, the most important factor is having a right team at the logistics and supply management. Without a good team, all efforts will be in vain. You can see some of my staff happy, smiling, and saying hello to you. Thank you very much for listening.
Thank you very much for keeping to time. And I would say I have learned, I don't know about everybody else, I'll pick one or two traits. Because logistics does not really have to be applicable to healthcare service delivery system alone. When she told us about the neuropsychiatric hospital, it doesn't have to be the antipsychotic drugs. It's applicable to even running the home. It's applicable to running any office. So this applicability is what we should look at. And then when we are talking about infection prevention and control, we want to make sure we can apply whatever knowledge we have picked up to other things. Now, I want to throw the floor open for questions, clarifications, and concerns. Can be applicable to what you're doing, and she spoke. Actually, I was waiting to hear about what happened during COVID, and I'm glad that she did address that. And it shows that, when you plan, when you forecast, we say anybody that fails to plan is planning to fail. Nobody foresaw that COVID was coming. But it shows you need to have a good relationship with your manufacturer, with your suppliers, and I think that case study speaks volumes. So I'm throwing over the, if you want to ask a question, you put up your hands before we go through the 4 questions again, and then we'll discuss that and then round up. So, over to you.
Thank you, Dr. Shande. I would like to address Dr. Sulaiman's question. He's asked that what is the difference between an end user and a consumer? Now, an end user and a consumer, they're interchangeable terms. But what I would say is that an end user can also refer to the prescriber or to the healthcare worker that is going to use that commodity on the final consumer, on the patient. Let me use something like in IPC. Let's use something like gloves. Now, the end user is not really the patient. It's the healthcare worker who is taking care of the patient. So depending on the item, it might be interchangeable, and sometimes the end user is the consumer. Thank you. I hope I have answered your question. Please, any other questions? Let's go to the chat box.
You can type in the chat box or put up your hand so that we have clarifications and then we are all clear.
There are no questions in the chat box.
Any questions, any reaction? Like she's compared it to IPC supplies, our PPEs, it could be our liquid soap, it could be our chlorine. But one question I think I have for Mrs. I know we used to have the stock that you shouldn't go beyond a certain stock.
Yes.
Yes.
We have what we call the reorder point.
Yes.
The reorder point is the point at which you determine it based on your organization or facility. You will know that maybe what you want, what the level at which you must start reordering is maybe when you have only 1 month supply left. Now you can, this is a bit, I don't think this is, well, by the time you have stock of, maybe 1 month or 2 months, you are the one that will determine at what stage you think you should start to reorder for new commodities based on your lead time. That means the time between when you order and when you receive, or the pipeline length, time you order, and the time the manufacturer takes to get it to you. That is what determines your order point.
Yeah, thank you very much. So I know that during COVID, even the ships were all grounded. And we will know that the ship would bring the things in 3 months, but because of COVID, it was extended. So we need to have that for Mrs. Peters, there's something for you. Thank you for your presentation. How do you handle suppliers who shortchange your supplies?
No,
There are many types of shortchanging.
Yes. I don't know what you actually mean by shortchange, but you see, because when they supply the medication, the auditor is there, the pharmacist is there, the store officer is there. So really, everything is checked before you can pass your paper for payment. But as you said, there was a particular time, there was a patient, I remember now, that a supplier that brought in a brand of, I think it was amitriptyline. Normally, amitriptyline is packed in 500. So this part, and we're used to looking at it in 500. Unfortunately, I don't know the auditor was that came that and seemed it in 250. So they actually brought half of what they should bring. Unfortunately, the pharmacist discovered this. And because they had not paid, it takes like 4 months as I had to pay them. So of course, we have to make him bring the balance before his papers was passed for payment. So that's the way we deal with sorting. We do not pay immediately. So if by chance something creeps past us, we will get you at the end.
And I think you did mention something about a tablet that should be 100 milligrams, yes. But you send to the labs because we actually check. Because we are all Nigerians, and because we are Nigerians, maybe spot checks once in a while, just to make sure it's the number of milligrams that you ordered for that was nice. And I think that's another way of dealing with that. I hope we've addressed that. Input system. Input system, what is the units? Can you read?
Yes. Sorry, this is from Grace Ogenenbori. Input system, what if the units don't need what is pushed to them? E.g. supplying shoe covers to postnatal wards. Truthfully, what you said is very, it happens. I used to work in a healthcare facility, and sometimes, especially with things like donations, maybe some United States organization just brings you things that you have never even used before. And after a while, you just look at those things, and I'm assuming that is what the people in the store, they do, especially equipment. If it's drugs, you will get or consumables. But when it comes to, some types of equipment, they just issue it to you, and you just find that there's a container that is marked in liters and somebody is using it to buy food. That's what happens. But that is why. Now, the way to go about it that we decided was that we do not receive donations that are not useful to the facility anymore. If you want to donate, you have to write now. You have to write and list what you want to. Because a lot of people to use our country as a dumping ground for things that are obsolete in their own sectors as well. So, yeah, but now and again, so a company might decide that a drug is about to expire in 6 months and they bring it, and you don't have patients that need it that much, So what we try to do, we try and instead of giving somebody 1 tube of a cream, you end up giving them 6, just to make sure we use it and we don't label, we don't have expired stock. So you're allowed to use your discretion depending on what it is, to handle those type of circumstances.
This is Peter's action.
I wanted to say something about that.
Yeah.
And there was a time, we work in the psychiatric hospital, and there was a time they gave us theatre booths in the hospital. We lost our theatre psychiatry. They were there for a long time. So what happened? We gave them to nobody wanted them. So we gave them to the gardeners to use. You know, they gave us a lot of this, and then some said they give us this thing. So what we do, we have hospitals around us. So we now exchange. Okay, they gave you maybe have a peridol injection. Yes. No use it. We now exchange. Okay, you take this and take this. So that's the way around it. So teamwork. Teamwork. Yes. Yes. Teamwork.
There's another chapter.
Yes. Okay. For who? It's for me. So like I said,
Can you read it?
okay. Now, thank you. How do you handle indiscriminate prescription by the prescriber? That's a very big one. But you see, as I said over the years, we pharmacists go on ward rounds with our doctors, and we have a good rapport with them. You know, sometimes when a sales rep comes, and then you begin to see something like, let me say, a multivitamin, you know that, oh, this person has come. And as you know, so they go. So we just tell them, look, sometimes it's as bad as that, the antidepressant they're using is even way cheaper than this multivitamin you're doing that is also necessary. And then the patients are telling you, oh, my doctor said I should buy this. So we talk to them. You know, we know when these things happen, then we talk to them. But sometimes we use our discretion and give that, okay, we don't have this is what we have. And your patient has to go home. So you just have to have a relationship with them, use your discretion, so that I'm not selling you the wrong thing. You know, so we are pharmacists. So we know what we should do.
But I hope that addresses your concern. But the thing is that the health team should be a team.
Yeah.
And you know, last month we had the antimicrobial stewardship, and that means there must be a committee to discuss that, and there are no problems that are insurmountable. It can be resolved. Because some people may just want to just prescribe, but luckily, Neuropsychiatric Hospital is a specialist hospital, so we expect the consultants, to know what to do and then to have interaction with the pharmacy department. But we know we could have some difficult doctors.
But you know what you do is that we don't buy too many brands.
Yeah.
You know, because as I said, our patients are very particular. If you are giving them white chlorpromazine and you bring red chlorpromazine, you have a tough time convincing that it is the same thing. So we don't buy too many brands. So that's the way we deal with this issue. So if you have more than 1 or 2 brands, people. So that's what we do.
So when we are tapping into our experience and the case study from the Neuropsychiatric Hospital, Yaba, and then be able to apply it to wherever we find ourselves or wherever we handle to make sure that we succeed. Like the hospital that started 1907, and that is over 100 years old, that is going to 200 years, and they are still one of the top hospitals. For us to be able to maintain that level of competence and acceptance, it takes a lot of planning. And I'm hoping that IPC will come to that as well. But she did mention about the theater books. And I was saying to myself, theater books. Why should anybody go and donate that to a psychiatric hospital? It's like dumping. At times they have hospital beds when they are boarded it, they can't use it anymore, they just ship it here. So it means that we should be up and doing, but we will get there. We'll get there. Any other questions? No other questions. Thank you for joining today. I don't want to thank you. Thank you, okay. But please, we need your feedback. Go to the chat box and feed the feedback, and then we'll give you 2 minutes to do that, 2-3 minutes, and then we'll go back to the poll questions. And I think Mrs. Omisore will handle that. Look at the questions that you gave, and then now give us what is the right question. And if there's any concern from Mrs. Williams, we are really desperate to have the 2 of them on this session. So we'll give you just 2-3 minutes to finish the feedback, and then we'll go back to logistic management poll questions. before we round up our plan for next month. So we'll wait a bit for you to give us the feedback. Well, I know it's not IPC specific, but Mrs. Omisore was broad-based, it's the health system, and IPC is part of the health system spectrum. And I'm sure we'll take in one or two lessons home.
We need to show them the results of the course. I'm going to show them.
Sure, it's not.